I think the best evidence is for using medication-assisted therapy, but there's many other supports for that as well. People often will say that it's not sufficient to prescribe buprenorphine or methadone or naltrexone, but in many ways that is the first step towards recovery. I think that in the setting of a larger setting of harm reduction, we can't really get to recovery unless we survive long enough to acquire the tools that are necessary for recovery. So that being the initial step, beyond that would be any number of other approaches, whether it's conventional psychotherapy or substance use programs, but also more innovative and creative approaches such as contingency management, which basically incentivizes not using, finding other things that are more attractive, even if it's just a very small reward. But having accumulated some of that experience of small rewards, people become more skilled at, more skilled at choosing better choices. The use of acupuncture for opioid use disorder, there's been a lot of interest for several decades now in whether this is a useful tool or not. And anecdotally, certainly there's a lot of support for it. Now, the research on it is more mixed. And one of the issues there is that in trying to design a study for acupuncture, the expectation is we need to have some kind of needle control. So putting in needles in points that are not the official, so to speak, acupuncture points that are being investigated. Now, there really is no way to say that putting a needle in the body is an inert intervention. So until you have a control for that, then you don't really have a controlled study. I think that it'd be more useful to do a comparative effectiveness trial, but there's a lot of resistance to seeing that as good science. The thing is, science is not as clean as we want it to be. We don't live in controlled environments and controlled situations. We live in very chaotic and unpredictable ones. So, having a more naturalistic setting and investigating whether adding acupuncture to conventional treatment is useful, or giving patients the opportunity to choose what type of treatment they want and comparing the outcomes from that. I think that would be a more useful way to investigate it.